Hello. This is Dr. Abdullah Kamal, and this is your YouTube channel, Just Pass It. Today, we're going to talk about colorectal cancer screenings, which is very high yield, especially for step 2 CK and step 3. So, just let's get started. So, colorectal cancer screening, we categorize people into three groups, okay? Normal population or high risk or patients with ulcerative colitis. And when we talk about colorectal cancer screening, we expect you to know two things: when and how. When shall we start the screening and how we're going to do the screening, okay? So, in each of those three categories is different regarding the age of starting the screening and how we're going to do it. So, we're going to just put a table here exactly like this, okay? And we're gonna post some numbers. If you have like visual memory, you can just like remember it as it is. So we're gonna put here 45, 40 minus 10 plus 10, 10, 5, 3, 10, 5, 3. Okay. So what do I mean with those numbers? So let's get started. Let's say we have normal population, which means they don't have ulcerative colitis, they don't have high risk. And when I say high risk, I mean first degree relative or adenomatous polyp. Okay, so we have someone normal, they don't have ulcerative colitis, they don't have relative first degree relative with colorectal cancer, or they don't have adenomatous polyp. They don't have either of those. So we call them normal population. So a normal population, we're gonna start the screening at age 45 years old. Okay, so when they hit the 45 years old, we're gonna start the screening. So what do I mean by 1053? 10, you have three options here: either to do colonoscopy each 10 years, or you do CT scan every 5 years, or you do something called FIT DNA, which is basically you look for the DNA in the feces or the stool. So it's 1053 again, normal population. We start the screening 45 years, and it's 1053. Either you do colonoscopy each 10 years, or CT every 5 years, or fed DNA every 3 years. And actually, there's another option, which is you do like fecal occult blood every 1 year. Okay. Here, let's move to the next group, which are the high risk group. You get a relative. They got a relative, for example, we got the patient, his father or his mother got colorectal cancer at whatever age, or he himself, we did colonoscopy before and we know he has adenomatous polyp. Okay, so those are the group 2. So when I say 40, I mean 40 years old. And when I say minus 10, it means 10 years before the age of the diagnosis of the first relative, whichever comes first. Whichever comes first. So what do I mean with that? So I'll give you two examples, and from those two examples, you can understand what I mean. So let's imagine we have a patient, okay? His name is Peter. So Peter's father, he got colorectal cancer, let's say at age 50, okay? Or no, let's say 55, okay? So 55, we have two options: either to start the screening at 40, or we subtract 10 years from the 55. So the 55 will be 45. So we have two options: either to start the screening at 40 or at 45. So what we choose? We choose 40 because it comes first. So that this is the meaning of whichever comes first. Another example, so we have another patient. His mother got colorectal cancer at age 40. Okay, so we have two options: either to start colorectal cancer for the patient at age 40, okay, at age 40, or we subtract 10 years from the age of the diagnosis. So his mother got the colorectal cancer at age 40, then minus 10, it's 30 years. So do we choose 30 years or 40 years? We choose 30 years. Why? Because we said whichever comes first. So let's say 40 years or minus 10. That's the age or the timing of the screening for those high-risk people. Okay, so five, what I mean by five is colonoscopy. So again, high-risk people, those with first-degree relative, or uh, they themselves, they have adenomatous polyp, we do the screening at age 40 or 10 years before the diagnosis of the first relative, whichever comes first, okay? And how we do it? We do it colonoscopy each 5 years. Okay, ulcerative colitis, plus 10, which means 10 years after the diagnosis of ulcerative colitis of the same patient, okay? It's not family history here, it's the patient himself. So for example, we have a patient, he got he got ulcerative colitis at age 20, okay? So we start the screening from 8 to 10 years after the diagnosis, so let's say about 30 years. If they got the ulcerative colitis 30 years old, then we're gonna do the colorectal cancer screening at 40 years, right? So just like at 10 years. And usually it is every 3 years, and we do colonoscopy. So here we answer when, and here we answer how. Again, colorectal cancer, normal, high risk, ulcerative colitis, high risk, first degree relative or adenomatous polyp, normal, 45 years, 1053, 1053, 10 colonoscopy, 5 CT, 3 FIT DNA, we look for DNA in the feces, high risk 40 or minus 10, and we understood what does it mean, and we do it every 5 years. We do colonoscopy. Ulcerative colitis, we said plus 10, which means 10 years after the diagnosis of the ulcerative colitis, and we do it every 3 years, and we do colonoscopy, okay? So those are very high yield. There's another information here is low yield, but those it's very important for people who want like above 260 in CK. So the question says we have a patient X, okay, patient X, and his father, okay, father of patient X, he got the diagnosis of colorectal cancer at 60 years old. Okay, when when um, when and how we start the colorectal cancer. Okay, so we have a patient. This patient has a father got colorectal cancer at 60 years old. Okay, so he has a risk. He's like from the high risk group, right? So we start the screening either at age 40 or 60 minus 10 equals 50. So we have 40 and 50, so we choose 40 because this comes first. So this is the first answer for when and how. How we should do colonoscopy every 5 years. That's what we said. But here's the exception. Here we do colonoscopy every 10 years, not 5 years. So why? So patients with family history of first degree relative of colorectal cancer, but their age is 60 or above, we don't do the 5 year rule. We do 10 years, and this is the only exception. Okay, so this is it for now. I hope you guys liked my video, and if you like, please subscribe and like my video. Goodbye.